Hi, Mar. Is there anything we as consultants do for babies who have sleep myoclonus? Yes, there is. First, we want to know, when was this diagnosed and who diagnosed it? If it was a self-diagnosis by a parent or other caregiver, we immediately want to refer out, because sleep myoclonus can mimic and look very similar to epilepsy, as well as periodic limb movement disorder, and so on. So we want to ensure exactly what it is. Next, keep in mind that as sleep consultants, our scope and boundaries to practice is not to treat. So it's not our job to fix the sleep myoclonus or to treat it. It is our job to be very well educated, to do our research about it. So after you have confirmed when this began, who diagnosed it, it was officially diagnosed by the proper licensed professional, then at that point, when you're sure what it is, you want to do your research to find out how it's affecting everything that you know about child sleep. And if there's anything that you can provide your client to ensure that that situation is supporting the child in a way where, again, it's not fixing sleep myoclonus, but perhaps it will help to improve the situation. When you do your research, one of the most common things is, what is the cause? And this is coming now from the Sleep Foundation. So what they're saying in terms of the cause is that researchers are not sure what causes benign neonatal sleep myoclonus. Experts have hypothesized that the movements may occur when the protective sheath around a baby's spinal cord has not yet fully developed. With all that said, as you all know, part of what makes us unique and why we love what we do is because we connect the dots. So something that you can do is you can provide a lot of information and education. We can help our clients understand and take a closer look to evaluating their health and lifestyle. It's not uncommon for researchers to later catch up upon things that people are finding out on their own. There is a fine line, and we do want to honor that fine line. We don't want to overstep our boundaries. We definitely don't want to say that we're treating or we're providing a cure for the sleep myoclonus, but we can help our clients confirm that it was properly diagnosed. We can help our clients evaluate their situation more to see if there's something going on physically or mentally that might be attributing to this. Because again, it can be something physical, it can be something emotional. That doesn't mean that because the researchers haven't found or are not sure of the cause, that we should sit back and do nothing and just say, okay. No, as sleep consultants, we absolutely can connect the dots, provide information, and we will simply use the proper language. So I would say to my client, I am not a doctor. I'm not a licensed medical professional to diagnose or treat the sleep myoclonus, but what my job is to ensure that I'm providing the optimal sleep foundations for your child. So we're going to be ensuring that the environment is properly set up, everything in your health and lifestyle is properly set up. And I'm also going to provide you some information to help connect the dots so that you can thoroughly evaluate the health and lifestyle of yourself and your child to see if there might be a connection there that you as a parent may pick up on that might lead to understanding or learning more about what's happening. Those are the things that we can do. That's how we can empower our clients. Those questions that we ask them are very, very powerful and can lead to those light bulb moments that go off where they go, oh my gosh, I figured it out. And with our help, they can do that. I decided to do a little bit more research to find out if there were any parents who wanted to share their experiences and possibly some of the interventions they may have done in their own experimentation with their child. And sure enough, I did find one, and it was pretty remarkable. And so I want to use this as an example to show you how empowering it is when we provide parents, not just us. I mean, parents can do this on their own, as this incredible mother did on her own. But when parents are working with us, we can empower them and support them to investigate things further, to connect the dots, which is exactly what this mother did. She connected the dots that her child had a birth trauma. And as a result, there could have been possibly something in that birth trauma that may have misaligned. And the pediatrician told her, no, that's not it. But she still followed her instincts, went ahead and started seeing a chiropractor. And she started noticing some immediate differences. In addition to that, she also introduced fish oil. She also introduced some homeopathics. And she made it very clear on this video that she's not at all saying this is the treatment for everyone. She's just talking from her own personal experience. And so she's not at all saying that this is a treatment for everyone. But what she is saying is that we went through this situation and this is what we were told. This is what we found out. This is what we tried. And immediately after the peak, it was like her baby reached a 5-week peak of the sleep myoclonus. And within 2 weeks of this intervention, it minimized and went away altogether. And this mother expected her baby to have the sleep myoclonus for months, even up to a year. Even her midwife said she didn't hear about this condition before. So the pediatrician first said, oh no, the sleep myoclonus probably had nothing to do with the baby's head on the tailbone. The midwife wasn't sure the condition. So see, these qualified, very valuable professionals, of course, they have a lot of value to them, but even they were limited in their own capacity to understand the situation as much as the mother's capacity to connect all the dots in the situation and then figure out, oh my gosh, could it be this? Could I do that? Right? And so once again, the specific treatment she tried is exactly what she needed for her specific case with her child. This is not a cure for every single child going through the situation because, again, the cause may be very different and there might be completely different things going on. We as professionals are not going to say, you need your chiropractor to fix this condition, or it's going to be the fish oils, or the homeopathic is the way. We don't know that. What we want to do is we want to help them investigate all the possibilities, share with them a variety of resources, have their own intuitive guidance kick in and connect the dots and see, oh yeah, could it be this or could it be that? Because as I said, look what the pediatrician and what the midwife said. So easily, any parent, when they say, oh, your child will grow out of this. If it's a benign sleep myoclonus, they'll pass through it. But she could have sat back, not have done anything, not investigated things further, and then continue to have her child just ride this out for a longer period of time versus her going, is there a way that I can provide some intervention here because of all of the things that I understand my baby went through, right, from birth and on. And so she empowered herself. So that is what we can do. We can help empower our clients with education, information, resources, connecting all those dots. Look what can happen.